Hi, I'm Dr. Oriaku, a sleep and pulmonary physician. Welcome to Dr. Oriaku's Corner. Today, I wanted to share why I chose sleep medicine as my specialty and really why I care so deeply about teaching it. First, I am an internist. That means I trained in internal medicine. In other words, I trained to care for the whole adult human being with all of their complexity. Because even during medical training, I realized something about myself quite early. I was fascinated by all organ systems, not just one. For example, during my nephrology rotation, yes, the kidneys are interesting, very interesting. But even while learning about the kidneys, I kept wondering, what is the heart doing? How is this affecting blood pressure? What about pain? What about mood? What about sleep? What are the trade-offs of what we're doing? How does one decision ripple into other systems? At the time, that made me feel a little disorganized, or at least I worried that it did, but my fascination was stronger than my discomfort. So instead of getting stuck in feeling bad about how uncertain or all over the place I sometimes felt, I kept following the curiosity. And in retrospect, that is a big part of why internal medicine was such a natural fit for me. I wanted a field that allowed me to keep asking, how does the whole person fit together? Now, my decision to train in pulmonary and critical care medicine is its own story, and honestly, it deserves its own video. But when it comes to sleep medicine, the story took me by surprise because if I am being honest, at one point I thought sleep medicine was mostly sleep apnea and CPAP, which is important and helpful for patients, absolutely. But at that time, it did not yet feel expansive enough to satisfy my curiosity. Then, during my pulmonary and critical care fellowship, on what was honestly a random but also very regular day for me, I was reading at home. And here is my embarrassing side note. When people ask me what I do for fun and I say reading, I have learned that I need to explain that I mean reading medical textbooks and journal articles, because if I don't explain that part immediately, people assume I mean general nonfiction, and then I have to awkwardly clarify later. And I used to feel embarrassed about that. Now I mostly just accept it. That is genuinely what I enjoy. So on one of those reading days, I came across an American Heart Association article on sleep apnea. And something about that article landed differently. It was going into the pathophysiology of sleep apnea and its cardiovascular consequences, and one detail in particular grabbed my attention: the discussion of negative intrathoracic pressure swings, which is the large pressure changes that occur in the chest during sleep apnea events. Now, this was not the first time I had learned that concept. I had seen it before, but on that day, it hit differently. It stopped being just a fact I knew, and suddenly I had questions, a lot of questions. Could identifying sleep apnea early be one of those low-hanging, high-impact opportunities in health? If we identify it earlier and treat it appropriately, could we reduce cardiovascular risk, the number one killer for so many communities? Could we relieve suffering in a bigger way than we often realize? And that opened the floodgates further. What actually causes sleep apnea? Is it preventable? Is it reversible in some cases? What exactly is the body doing in response to sleep apnea? Why do some people suffer so much and others go undiagnosed for so long? What are we missing? Any attendant who would listen got bombarded with these questions. Some entertained me, some were generous enough to engage, and some looked at me like, what's up? What is going on with you? Because once I became interested, I became very interested. Those questions turned into published and unpublished articles, failed research attempts, and a lot of deep reading. And spoiler alert, I am not a basic science researcher. I deeply appreciate our colleagues who produce the work I get to read, question, and sit with. But I am someone who loves to brood over physiology and translate it into clinical practice. And that one article, plus many more that followed, gave me enough curiosity and enough conviction to apply for sleep medicine fellowship. And I am so glad I did. Because before that, I truly thought sleep medicine might be boring. I was so wrong. Sleep fellowship was a blast. The more I learned, the more fascinated I became. I learned about the physiology of sleep, the pioneers of sleep medicine, the bold and sometimes ethically troubling early experiments, how young the specialty still is, how much is still being discovered, and how foundational sleep is to health, recovery, resilience, and suffering. And that changed my understanding completely. What began as curiosity about sleep apnea became something much broader. I realized this is not just about sleep apnea. It is also about insomnia, restless leg syndrome, circadian timing, recovery, and the way sleep touches nearly every other organ system in the body. It affects mood, cardiometabolic health, inflammation, healing, and quality of life. So what I initially thought was a very narrow doorway turned out to open into one of the most integrated fields in medicine. And in a way, sleep medicine brought me back to the reason why I wanted to study medicine in the first place. I took the long way around. I wanted to contribute in whatever way I could to the alleviation of pain and suffering in my community. Sleep medicine brought me one step closer to that. Because when sleep is suffering, so often everything else suffers with it. And when sleep improves, it can create room for healing in ways people do not always expect. And that is part of why I created this channel. Yes, to teach. Yes, to explain. Yes, to make complex physiology more understandable. But also, honestly, to nerd out. To share the kind of learning that brings me joy. To explore the body with curiosity and respect. And hopefully, in doing that, to help make your own health journey a little less confusing, a little less lonely, and a little less heavy. So that is why I chose sleep medicine. And if you are here, I am glad you are here. This has been Dr. Oriaku's Corner. I hope the space brings you insight, clarity, and maybe even a little of the joy that this field has brought me. Thank you for joining me.